And
Yeah.
the thyroid is the master endocrine gland. It is controlling the hormones. It's controlling the adrenals. They're all connected and speaking to each other. Do you want to speak a little bit more on that little triangular relationship?
Well, sure. I mean, yes, all hormones are speaking with each other, and there is a bit of a hierarchy and a feedback loop, right? So it starts in our brain, our pituitary, that is then sending out signaling hormones to all of the hormone producing glands saying, stimulate thyroid, stimulate follicles, stimulate adrenals, stimulate pancreas. And so and it's working down a chain of command. When you think, top of our body down to the bottom of our body, it really almost does have that kind of chain of command where, thyroid is next in line. And so if the thyroid is getting misinformation or getting damaged, it's going to have an adverse effect on the adrenals, on the pancreas, on the ovaries, because they're all having relationship with each other. And then the feedback from all of this back to the brain. So the brain is going, oh, I see now. You've got excess thyroid spilled in your bloodstream because of this autoimmunity. Therefore, we won't stimulate the production so much because we're seeing excess thyroid when it is a snapshot of time that is having just this excess thyroid, but you're really having thyroid deficiency.
Mhm.
Same down at the ovaries. If there's polycystic ovaries and they're secreting androgens, testosterone, then the body's going to say, or excess estrogens that are not being cleared, then the body's going to say, well, I guess we don't need to start a cycle here because we're a little bit confused. We're seeing elevated estrogens, we're seeing elevated luteinizing hormone. And so clearly it's not time to then, trigger an ovulation or grow the follicles. And so everything kind of stops.
Mhm.
It doesn't know what to do. So we really need to clear the decks. And that's by detoxing, by eating. And then by detoxing, we're saying eat healthfully, drink healthfully, take the proper supplementation. Our bodies will reset. And that's where, again, back to the infertility, oftentimes it's subfertility that we can really reverse.
You have to remember your body's smart. It
Yeah.
wants to survive. It wants to provide the best environment for growing a baby. So
Mhm.
it's not going to do it if it's under some sort of stress, when things aren't working, when you're sick, when your liver's backed up, when your thyroid's so low it doesn't have the energy to do anything, let alone grow a fetus. So
Mhm.
all of these things in this, the unfortunate part is that traditional Western medicine just looks at each organ separately and doesn't address the communication.
Right.
And with the thyroid, if you take nothing more from this talk, get the full thyroid panel. Your
Mhm.
doctor is testing TSH and T4 and saying your thyroid numbers are normal, and that is not telling the whole story.